welcome to another iteration of Office Hours Live, where I answer your weight-related questions, your weight medicine-related questions. I am Dr. Garcia Webb. I'm so happy that you're here. There will be a replay later on my YouTube channel, Weight Medicine with Dr. Meghan. And if you've never seen this before, welcome. I am a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And I'm here to answer your evidence-based questions. I'm here to give you evidence-based answers to your weight questions. So yes, I eat, sleep, and breathe all things weight medicine related, and I'm excited to talk to you about that today. So if you want to work with me directly, you can. There's a link here to my website, whether you're in Massachusetts or outside of Massachusetts. And but let's jump into the questions for today. So today we are talking about lots of different things. First question is going to be a follow-up on a video that I did. So this question is with regards to, I had made a comment about protein and kind of loose protein goals when you are looking to build muscle and while you're on one of these medications and you're losing weight, because it's really important to preserve your muscle mass. So thank you with regards to the 1 to 1.2 proteins per kilogram of body weight daily. Yeah, that's a good goal. Do you have a ballpark recommendation for carb grams and fat grams per day as well? Well, the short answer is no, and I'll tell you why. I don't love the idea of getting super scientific and really basing our goals on very external sources. I think a lot of the weight related problems that we have are because we as humans just are not sensing when we're hungry and when we're full. We just ignore those completely. And we also, I think we're always looking for like the quick fix or like the one thing that's going to do everything, when, you know, like the human body has evolved to really be very finely calibrated to energy needs. So I don't think we need to overcomplicate it, is what I'm saying. I always recommend the book Food Rules by Michael Pollan. If you're wondering about what to eat, it's not a diet book. It's just really, really good advice. And I recommend that above any diet book, literally anything out there. That's what you should read. It's very quick. It's a very good read. But really, I think a good goal for people who are looking for like what to do in terms of like, you know, fat, protein, carbohydrates, things like that. Read that book, but also a goal of 5 to 7 servings of fruits and vegetables a day. So 5 to 7 servings of produce. And if you're really getting that, there's just not as much room for other things. So I would much rather have people focus on eating as much whole, unprocessed food as possible, getting a lot of variety for fruits and vegetables, and starting there, as opposed to like getting really technical with macros or anything else like that. I think we way overcomplicate it, and it doesn't have to be that hard. So I would really focus on that first, and Food Rules is really quick and it's great. I wish everybody read it. Okay, so that is an excellent question. Next question is, are there foods you need to avoid on Zepbound? No. What you want to do if you're on any of the GLP-1 agonists is you do want to be careful about a couple of things. And sometimes this happens very naturally for people, like they just start the medication, they're getting very strong cues from their body, and it's kind of easy to see where the guardrails are for them. Some people need a bit more guidance in terms of how to eat. And really you want to start, because a lot of times for people when you're starting this medication, your appetite can be severely reduced, or you could have a lot of nausea. And so, trying several smaller meals throughout the day. And also, your body will adjust. So, this may change over time and your appetite may come back, and it usually does. But several small meals over the course of a day to see how your body adjusts to that. Err on the side of smaller, because part of what these medications do is the slowing of the food. You've probably heard this term like gastroparesis, and it's gotten very kind of blown out of proportion and scary. But essentially, what gastroparesis is slowing, and it can be very pathological if it's severe. But what the medications do is they slow the movement of food through the stomach. So the food is there longer, and it's going to increase the strength of the signal from the stomach to the brain in terms of there's food here, we're feeling full, those satiety signals and the decrease in the hunger signals. So that's all going to improve, but sometimes that can cause some nausea or vomiting or reflux for people. So err on the side of smaller and maybe more frequent meals instead of like 3 larger meals per day. That's one thing you really have to think about. But then also, some people just feel like they don't want the same kind of foods that they ate before. They just feel naturally more drawn to unprocessed foods, salads, whole foods. That's great. Some people, if you're eating heavier food that has more saturated fat, it's just not going to feel as good. And it is going to be sitting in your stomach longer. So you might feel like, ugh, it's like this lump of lead in my stomach. I would probably err on the side of dialing back try like light, bland foods if you're having a lot of stomach issues. And you do want to make sure you're getting some protein. And plant-based protein is always good, but I would err on somebody having like tofu and vegetables versus like a cheeseburger. It's gonna go over a lot better with your stomach than a really higher density fatty meal. That could be very upsetting to your stomach if you're just starting the Zepbound. Not that you can never have that again, but you just want to be a little bit more careful. And then, yeah, just definitely, just take the time to really listen to your body on this new medication. There's no rush. There's no, there's no timeline. So some people, their body takes a lot longer to adjust on it. And so maybe they're going to do better on a, lower dose for 2 to 3 months. And of course, this is all goes without saying that you can access these medications for that amount of time, right? Shortages aside, somebody might want to be on the 2.5 for 3 months instead of 1 month. Totally fine. So yes, you don't have to avoid anything, but these are just things that you might notice. And so smaller meals, lighter, blander meals. Make sure you're still getting your protein though. Okay. Is it still going to work if I have to switch from Zepbound to Wegovy? I feel like I might have answered this last time too in a similar way. Yes, it should still work. And of course, I can't answer any personal medical questions, but in theory, yes, although there is some variability from person to person. So I definitely, overall, on average, are people going to get a better result in terms of total body weight lost with Zepbound? Yes, that's what the data shows. Is it going to be everybody? Of course not. Do most people seem to have about the same or less side effects on Zepbound? Yes. Again, not everybody, but sometimes for availability, or maybe you change insurance, or for a variety of other external logistical reasons, you have to switch from Zepbound and go to Wegovy. Um, I think I wouldn't, and it depends on, the starting dose that somebody, the dose of Zepbound that somebody is going from, and then the dose of Wegovy that they're going from. So let's say if somebody was on 15 of Zepbound, which is the maximum dose, I probably wouldn't jump to the 2.4 of Wegovy. I would probably dial it back a little bit to the 1.7, maybe the 1, depending on what is available. And just to make sure there's no side effects when they're changing over, and then you can ramp back up. What else? Yeah, so I think I wouldn't expect a drastic change for most people. If you're already on the maximum dose and you've kind of reached your new normal, and then you go to Wegovy, there might be some fluctuation of your weight, and maybe where you settle with your new normal on Wegovy is maybe a little bit higher than where it was with Zepbound, but I wouldn't expect like a very drastic change, essentially. Okay, that is another great question. Thank you. Okay. Does hypnosis work for weight loss? Oh my gosh, that's such a great question. I don't have a problem if patients want to try hypnosis. I think I'm sure there's some literature about it. I think I've definitely had patients that had great results with hypnosis for smoking cessation. I don't, off the top of my head, I don't know what the data shows, but anecdotally, I will say that I've definitely had patients, and I've actually had a couple patients who did hypnosis for weight loss. This was a while ago, and they did have good results. So I think if it's something you want to try, I don't have a problem with it. If somebody told me they were going to try hypnosis versus somebody like went to a compounding pharmacy, like 100% of the time, I'm going to much rather have somebody go to hypnosis. You know, sometimes, your primary care doctor may have people that they recommend, or you may have friends that saw a hypnotist. Obviously you want to make sure you're going to a reputable person. And obviously, if it's something that's not working, don't continue it. I wouldn't want somebody to do it for, and oftentimes insurance won't cover it. So you want to make sure you're getting results. It's not something I would try for 2 years without seeing results. But I don't have a problem with it. And I think it could be, if somebody's seeing a reputable hypnotist, I think it would be worth a try. So yeah, great question. Love that. Also, this is not a question, but I did want to just address this new Nature study that came out. I will leave the link for the PubMed article for it, but there was a really interesting Nature study that just came out that found some 2 gene disruptions that were found to have a large impact on adult onset BMI and obesity. So just more evidence that obesity is heterogeneous, and for some people there's definitely a larger genetic component than for others. And for these, it was about, the research suggests there might be some, the way that the significance of these genetic findings suggests there might be some disruption in the neurobiology of feeding and appetite regulation in the brain. So I think it's very new research, and just helpful, I think, for people to know that for any medical issue, usually there's always a balance between genetic predisposition and lifestyle, and for some people, certainly there is a stronger genetic component than for others, and this just helps us see that more clearly. So yes, I will leave the link below if you're interested in reading about that. And I think that's going to do it for today. So thank you so much for watching. I'll put the replay up on my channel later, and please be well.